Hello, my name is Reggie Chapman. I use he, him pronouns. I am the Director of Policy at the Fortune Society's David Rothenberg Center for Public Policy. Welcome to Both Sides of the Bars, which is a discussion driven show that examines the criminal legal system from various perspectives, including people most affected by the system. Here we discuss critical questions about how the criminal legal system works, its intersections with social justice, and the efforts that advocates are making to improve the lives of everyone affected. We ask that you, the viewers, spread the words about both sides of the bars and share your comments with us on Twitter, also known as X on at Fortune SOC. Today's show is titled Public Safety Through a Public Health Lens. In today's show, we will examine public safety through a public health lens and explore how issues like violence, incarceration, and community harm are shaped by the social determinants such as housing instability, unemployment, and a lack of healthcare access. Research suggests that public safety is not only a law enforcement issue, but a public health issue that affects the health and well being of individuals, families, and communities. We discuss how public health approaches of focused prevention, healing, and community investment can reduce harm more effectively than punishment alone. By treating safety as a collective responsibility rooted in dignity, equity, and restoration, we can move away from receiving and reacting systems towards healthier and safer communities. This episode features Ted Alcorn, whose expertise, among many things, lies in violence, policy, and public health. Ted Alcorn is an award-winning journalist and researcher. He teaches on gun violence, criminal justice, and policy at Columbia University's Mellman School of Public Health. His work examines how law, data, and social conditions shape violence and health. It also aims to advance the public health approach to public safety. Good afternoon, Ted. We're excited to have you here on both sides of the bars.
Good afternoon. I'm so honored to be invited.
Great, great. And we're so honored to have you here. So I guess with no further ado, we'll just jump in some of the questions that we have for you today. So the first question is about framing the shift. And we know that you've written and taught extensively about violence and public safety. When we advocate for viewing public safety through a public health lens, what does that actually mean in practice? And how is it different from the way we approach public safety today?
I think it's a great question. And it's one that I wrestle with because I encounter that term a lot, public health. And I think it can mean very different things to different people. And I think when we apply it in the conversations around criminal justice, public safety, it can resonate with people, but sometimes for different reasons. So I think it's really worthwhile to unpack it. And I think typically when we're thinking about public health approaches, well, you got two words in it, right? You got public and health, not to oversimplify. And so, public health historically has really focused on populations, on the public, rather than individuals, kind of drawing a contrast in the medical world, right, between somebody who's focused on how to increase the health of a patient, like a doctor on an individual level, versus someone who's working on trying to raise the quality of living for a whole population. And then the health part, right, is that it really focuses on health and well-being, although public health is pretty expansive in terms of how it defines what well-being is. And you will find people who work in a public health role or who consider themselves a part of that, who can focus on a whole array of outcomes. But I mean, I still think that in general, public health is trying to improve health and well-being rather than maybe like security or order, which is sort of more of a public safety lens. But then I think that there's some other things that also are implicit when we say we want a public health approach, at least for some people. And it's worth thinking a little bit about how true they are, really. I think some people think that public health approaches are pursued sort of exclusively, or at least led by people with public health degrees or in public health agencies. And I think some people who are skeptical of people who've worked in the criminal justice realm for a long time say they want a public health approach because they want to take some agency away from maybe someone like law enforcement or prosecutors or prisons. Um, that can be a way that it is applied. Although I personally think that when I look at what some police, some prosecutors, some prisons do, I think that they can actually participate and arguably do public health. So I think that that can be a part of the discussion, but I don't necessarily try and exclude parties from who can participate in public health myself. Um, and then I think that there's also behind all this maybe sort of a philosophical bent, which is that people often think that the criminal justice architecture that we have in the United States is very reactive and very responsive in a sort of short-term way to the behaviors of the population. I think it's pretty fair to characterize the totality of our criminal justice system as working that way. People who behave a certain way, the criminal justice system reacts to that. Not a lot of thinking about the bigger context and thinking about what's upstream. There are parts of the criminal justice system that do this, but not so much. So I think that people, when they say they want a public health approach, they're also really saying, like, how can we look upstream, if you will? How can we prevent some of the conditions that in which behaviors that we are trying to avoid occur? How can we, in a sense, sort of like prevent ourselves from getting into areas where we have to respond with policing, with prosecution, and so forth? Um, and so I think all of those things combined are parts of what we mean when we say, you know, we want to invite and imagine and discuss a public health approach to some of these problems.
Thank you, Ted, for that robust, answer to the question. And you said a number of things in there that I find to be very interesting, but there are two things that I want to highlight for our audience. You talked about, public health practitioners and people that advocate for viewing public safety through a public health lens. And I'm actually one of those people. I'm a public health practitioner, and I advocate for that. But you said something that was very, very critical when you responded to the question. You talked about, public health practitioners are not the only people that can do public health work. And I think that's very, very important because in this line of work, at least trying to do the work I would like to do, I don't want to alienate people that actually work in the criminal justice system, criminal legal system, excuse me. I want to work with them and kind of like allow them to see that they are actually doing public health work. But it's also important too to shift the language and the psyche and how we think about our work, right? And that kind of like speaks to the second thing that I want to respond to, what you said. You talked about public safety, kind of thinking about a responsiveness to a problem, while public health speaks to like the preventative upstream approach. And I think that there's room to marry the two. I think obviously it's systemic in nature, and we have to start at the top, through legislative acts and a number of retraining of people that work inside the criminal legal system. But I think it's fair, and I appreciate you highlighting that, because oftentimes if a person such as myself or anyone who's stands under the banner of public health, and we're seeking to say we want to look at public safety through public health lens, people that are actually in the criminal legal system may look at us as adversarial, and we don't want that. We just know that they do the same work. We actually want to commend them in some part to some of their work, but actually work together and improve, share information, and improve the conditions. So I just want to say that to you, and I appreciate your response.
And
I want to go to our next question. Yeah, I'm sorry, guys.
and just to follow up on that, there's a couple of other parts of the public health sort of conversation that sometimes I think people bring in, and so for example, we tend to think of public health, or so I think some people invite public health to be a part of a criminal justice because they think, well, public health follows maybe a medical ethic where they aren't going to use force, so they're going to do no harm, and where we're going to use approaches that do not involve coercion the way that criminal justice system does. And I think that that's an understandable, like, sort of imagination of what public health does, but I was also try and remind people, like, public health has sometimes worked through coercion. I mean, a quarantine is one of the first public health tactics really for addressing contagious disease, and it involved, right, making sure that people forcibly were held away from the population for 40 days before, to ensure that they didn't have an infectious disease that they could spread. um, and also this idea of reactivity. We tend to think of the criminal justice system maybe as being reactive, but there are areas where where criminal justice folks work to do prevention. And the contrary is also true. Public health, right? We sometimes in public health have to react to emergencies. What, if anything, is sort of pandemic response other than like a reaction after the fact? So, anyway, just to say, I'm not trying to blur the distinction, but I think sometimes the separation that we create is a little bit artificial and it's a little bit more of a spectrum. So, just to second your views.
No, and I appreciate that. Before I go on to my next question, I appreciate that. That's kind of one of the things we want to do. Again, we don't want to create this adversarial thing between public health officials or practitioners and people that work within the criminal legal system. We want to understand that they both do some of the same things. And, I'm a firm believer when people or groups or theories see, when they have like vested interests or see some of themselves in the other, then it increases the likelihood that they can work together. So I definitely appreciate that, Ted. Thank you. My next question is about root causes versus response, and we kind of talked about that a little bit in the first question, but I'll ask it in somewhat of a different way. So, you know, a lot of policies still focus on reacting to crimes after it happens. And from your research, what are the most important upstream factors like housing, employment, or healthcare that shape whether violence happens in the first place?
Great question. Well, and as you alluded to, I kind of feel like I have the most expertise in the narrow but important part of violence that is to do with gun violence. And when we look at patterns of gun violence across the United States, um, we definitely see that it is shaped by factors that are bigger than any single individual person. And I think if you're thinking about gun violence through a criminal justice lens, you're thinking about good guys and bad guys, right? You're thinking about people who are making mistakes and causing violence as if this was all something that was derived from the individual. But if we zoom out, you can't help but see that the circumstances in which gun violence occurs are highly patterned, interpersonal violence particularly, and and some communities as a result experience a whole lot more of it than others. And it's not, I think, as easy to define what are the factors that shape like an individual's trajectory into violence, because a lot of people are exposed to deprivation in our society who do not end up involved in violence. But the area level factors, like the neighborhood and community level factors, are pretty clear that in neighborhoods and communities where there is a long term history of disinvestment, high rates of unemployment, and where poverty basically has caused a lot of the sort of social and structural problems that we see in communities that are afflicted that way. A lot of low feelings of efficacy, that the neighborhood can't work to solve problems together, um, and is not served well by the state. Those are all characteristics that I would say sort of are, you know, root causes in a way of the circumstances where then violence is more common. And even in neighborhoods that are very deprived in the United States, right, there's only a small share of people are involved with violence as perpetrators of victims, which I think is very important. Mostly young men. Historically, it's been men in the early 20s, but now actually we see a little bit of aging into 20s, 30s. Um, Mostly who have had high rates of unemployment, adverse childhood experiences, maybe substance use, and through their positioning in a social network that may provide access to guns that then creates this opportunity for lethal violence, which is really what is why gun violence is so concerning, because it's so lethal. So I would say that when we think about those constellation of factors, it's obvious to anybody these are all connected to poverty. Poverty is experienced by a larger community, and histories of trauma and violence. And so I think undoing those factors is complicated. It's among the most probably complicated challenges that human society faces. But those are the sorts of things that probably we need to be attacking if we're trying to think about how to really reduce violence in the long run.
Thank you, Taylor. I appreciate that. Again, you said so many things that I find to be important, but I do want to respond at least to one or two things. I think one thing that you said is very, very important when you think about like factors you talk about, like the individual, right? And how, in the criminal legal system, which I'm familiar with because I'm just impacted, oftentimes it is about the individual, at least how the criminal legal system approaches a person who's been charged or accused with a crime. And so, or committing, some indiscretion towards another individual. But at the same time, public health, at least in many cases, at its basis, seeks to look at the zoom out and the overall, like the collective, what's driving these things, and so I just think that's a tension that if we are going to be making this bridge between public health and public safety, just a shifting of the psyche. This slightly in the court system, I think that will give maybe create a pathway to for those on that side of the aisle to like readily listen to public health practitioners and how they approach violence reduction. And you also talked about poverty as one of the driving factors. I can attest to that. I think the data is clear. Obviously, like you said, violence isn't committed by everyone. There's actually a small population of people that commit violence, particularly lethal violence in that sense. And unfortunately, for other reasons, we tend to think that the nation is really suffering. Is violence is happening more than what it is, and that's another conversation. But I just want to say that um, yeah, this idea that, or the fact that poverty can in many cases drive violence is just something. It speaks to why public health is important. When we talk about resource allocation, when we talk about, and when I think about poverty, I'm not just thinking specifically about a dollar per se. I'm thinking about some of the things that dollars allow you to acquire. So it's just housing, healthcare, and obviously employment. And I just think that those things in themselves are they undergird poverty, right? I mean, they fall into it, but they undergird it. But again, as a public health practitioner, as well as a person who's, in advocacy, advocating for policies, and one who's looking to bring public health to the criminal legal system, I just think that's worth mentioning, and I appreciate your assessment of that. You work closely. Your work looks closely at how data and law shapes outcomes, right? How has data been used or misused to reinforce law enforcement approach to safety? And what would be the better use of data, and how would it look in the public health model?
Yeah, data and narrative are so central to how we as a society make decisions. And I think data, particularly when I say data, what I mean are a set of observations that are organized systematically, we can draw meaning from. Um, that word, that sort of scientific aura that it has, often gives people the sense that, oh, data must be neutral, that like whatever the data says we should do. The issue is that how we produce data and how we interpret it are shaped by power in our society and shaped by the way that the world is organized and how difficult it is to measure certain things. Some things outside of our control, but um, the data that we have and how we interpret it is not neutral. So it's always important to just be aware of how data is produced and what we have and don't have, and what that reflects as well. Not necessarily to follow it blindly. And so when we look at and believe me, I'm a big believer in data. I'm a big believer that empirical thinking based on observation helps us learn from the past to make better decisions in the future. It's so essential. So I'm not trying to throw data out with the bathwater, but there's been one of my I'd consider a friend and mentor, Jeffrey Butts at the John Jay College of Criminal Justice, has written really insightfully, particularly about criminal justice data, because he has wrestled with evaluating community violence interventions, and which often don't have the sort of research base available to show their efficacy that some law enforcement interventions do. And he's made the observation that, well, one, not only are law enforcement agencies in the US very well funded, very well organized bureaucracies that produce a lot of data, um, but they also often are intervening. They're doing their work at the level of the officer. So, research on hotspots policing, for example, may be looking at a huge sample of officers and how they're operating and how that can achieve certain outcomes. And when you have a lot of different people to observe, you get a high statistical strength in the study design. You can make conclusions with a great degree of confidence. A lot of community violence interventions have not been organized that way to collect data or to observe changes that way. And Jeffrey Butts would know, he's evaluated them. And he observes, some of these studies organized at the level of the neighborhood. And you might have one, two, three, four, five, six neighborhoods in your study, but you're talking about a much smaller sample. And so there's the statistical power with which you're drawing conclusions about the efficacy of that intervention is totally, it's shrunken, it's much smaller. So in a sense, the way that we've had to organize the science has caused us to be less confident and less able to statistically find evidence of impact that maybe some other more organized, and in this case, law enforcement efforts have. So that's not to say that either piece of evidence is irrelevant or wrong, but it's to recognize, wow, power and reality have shaped a little bit what kind of data we do have and we don't have, and we need to interpret it in the light of that. And so I think we're at the very early stages of seeing the development of a lot of non-police, non-law enforcement related safety interventions. And I think people are right to say we want to have better evidence, better data. We want to inform our future decisions better. And so we always need to be thinking about how to organize these interventions so that they can be evaluated, and then funders and others need to support and get those evaluations done and done well. But we have to, keep in mind, I think, as well, that we should be perhaps using a little bit of a different standard when we evaluate the evidence surrounding them, just because knowing where we are and how they've been studied in the past and what's possible.
I appreciate that so much. Again, so as a public health practitioner, actually, you said a lot of things that made me think about my own pursuit of public health and how I thought about things and what I wanted to do. And how that the work in which I want to do would affect change on the ground or how it wouldn't. You mentioned about like the scientific aura of the term data, and people think that when they hear data that it's automatically accurate, right? That it speaks to a truth. And as you just explained, there are various ways in which you can make misdiagnoses or misperceptions or conceptions about a phenomenon using data. Smaller sample size, it's not really powered well, individual bias, how you do your study design. You also the question also embedded this idea of narrative. That's something that I think is important. I don't know how much or how well the powers that be, for lack of a better term, accept that as a truth. I can say as a policy director and the one who advocates for laws and policies. In my short career, what I actually have experienced is that legislators are more interested in stories, one story, as opposed to just getting hit with data. And it also makes me think about something that Dr. Mindy Fuller talks about, this idea of narrative medicine, how one who has lived the condition, being able to explain it. I don't want to get too long winded because we can go down a rabbit hole. This is so exciting for me, having my background. But I do want to pose one last question. We're approximately like 5 minutes. So I want to pose this last question. I think it's very, very important. So I'll ask you. A lot of people now recognize the importance of prevention and community investment, yet policy and funding still heavily favor policing and incarceration. What do you think are the biggest barriers to shifting the political will towards a public health approach to public safety? And what will it take to make that shift sustainable?
Really? Well, that's $1 million question, right? Um, I think one of the catastrophes of public policy in the United States, particularly in the last 50 years, has been when we faced a lot of real, legitimate challenges, that have come certainly through our decisions and our history, often realized in the form of violence, addiction, separation from each other, um, segregation, poverty. We've reacted to them, out of fear and often with a distinctly sort of criminal justice order first approach. People in the criminal justice system, law enforcement, um, have presented a system that is reactive and that has showed up when people dial 911, and has directed itself towards these problems, not necessarily out of bad will or ill will, but not definitely not with the skills, the experience, and knowledge to really solve them. And we created this double burden for ourselves because the criminal justice approach to a lot of these problems has caused a double burden of harm, right? It has, in addressing on its face some of these challenges, created its own problems, often in a counterproductive way that has fed the problems it was trying to realize. So, what is really heartening, I think, is that we have a broadening realization. I don't want to say this is not something that a lot of people in the country needed to realize, but I think that realization needed to be shared through data, through stories, through creating a space at the table so people who had that direct lived experience could share it empathetically with people who didn't. um, is the realization that this was a terrible waste, um, and that although the challenges continue to exist, the ones that we have to address ourselves to help survivors and help them heal, to provide accountability for people who commit crimes, make mistakes. We have to create an opportunity for people to learn, grow, be forgiven, um, and we need
And
to
and
invest.
I totally agree. We're kind of up against time, but I thank you for you said something one of the most profound things that I think that we should leave the show with on the heels of that question, which is this idea of the double burden. We've created the problem, and it's up for us to address it. And I'll leave our audience with that note. Before we leave in the show, I just want to thank you, our guests, for sharing your thoughts to our point. Thank you to our viewers for joining us for a thought-provoking discussion. On behalf of the Fortune Society, we thank you for tuning in to both sides of the bars. If you're interested in finding out more about us at the Fortune Society, please check us out at thefortune.org, at thefortune.org. This is Reggie Chapman, and I appreciate you for joining us as we critically look at both sides of the bars. Thank you.